Now with a report on urinary incontinence. Here's our reporter, Laura Windsor.
Urinary incontinence is an embarrassing but very treatable condition which affects 12 million Americans. Dr. William Schmitt of Desert Regional Medical Center in Palm Springs explains the different types of incontinence and the range of treatments.
Stress incontinence is the spontaneous involuntary loss of urine on coughing, sneezing, laughing, exercise. Overactive bladder, which we used to call detrusor instability, is more a feeling of urgency, that they have to urinate very frequently and with very powerful urges, and if they do get a strong urge, they may not make it to the ladies' room. Diagnosis of the condition, the most powerful tool that we have is history. You'll want to ask a woman, how often do you urinate? Is this a problem? How often do you have to get up at night to urinate? What medications are you on? Certain medications can certainly lead to these problems. And then, what sort of medical problems does she have? Does she have diabetes? Does she have some sort of spinal injury? Has she had previous surgery, particularly surgery in her vagina or her pelvic floor? All these conditions are certainly relevant. And then one gets to a physical examination. Urodynamics are a very, very useful tool. And what urodynamics are doing is they're actually measuring the various pressures within the bladder, within the urethra. So, these are studies. Laboratory examinations, particularly a urinalysis. Now, if a woman is complaining of frequency, with or without pain, the most common cause is probably a bladder infection, particularly in a young woman. Well, this is going to be evidenced on a urinalysis. When we talk about treatments, overactive bladder is primarily a medical treatment. That's what you see advertised on television. All these medications, and what they do is they cut down on the neurological stimulation of the bladder so that the woman isn't stimulated to be urinating all the time. Now, stress incontinence, because it results from a lack of proper support in anatomy, primarily secondary to childbearing, but other causes, its condition is amenable to surgery. Okay? Now, there are other ways of treating it more conservatively. Kegel exercises, which are tightening the muscles, even weighted vaginal balls to make the woman contract those muscles. There's stimulation by electricity of the pelvic floor, and all these things have various modes of success, but it's primarily a surgical condition. Traditionally, we've made an incision, we've gone into this space, and we've put sutures through the heavy supporting tissue around the urethra, and we've anchored those. And the newest procedure, I say new, it was developed in Sweden in the mid-90s, is called a TVT, and that stands for tension-free vaginal tape. And that means there's no sutures involved. Actually, what it is just a piece of tape, 1 centimeter in width, and a long piece of tape with a mesh. With just a mesh. And it's been done in a couple of different ways. There are certainly more than 2 million of them done now. Its success rate is 85% in the recent studies over a 5-year period, comparable to any other procedure that we've ever done. But the beauty of it is, it's simple. The procedure doesn't take very long, it's highly effective, and there's a minimal amount of discomfort, especially for those of us who have been doing these procedures for a long time and have seen, the amount of discomfort with more traditional procedures. This has really been a real step in the right direction. It's effective, it's simple, and it is minimal amount of discomfort. The woman's back at work, back to a normal life in a very short period of time.
With all the treatments available to control or cure incontinence, there are definitely options available for most sufferers. I'm Laura Windsor for the American Health Journal.